Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I am going to show you tips on how to answer questions during VIVA. Remember, NMCN from last year, that's 2024, they have set a day for VIVA alone, most especially during RN exams, right? So if they have set a day for VIVA, remember the examiners may ask you a lot of questions during the VIVA because they have all the time to do that. So now sit back and watch this video till the end. Do not forget to like, share, and subscribe to my YouTube channel at Nurse Clement B. And in case you have any challenge in any of the procedures or topics, please drop it at the comment section and I will have time to attend to it. And if you want one-on-one class on any procedure, please do not hesitate. Reach out to me on my Gmail at Nurse Clement B. Just send me a mail and I will attend to you there and teach you. Right? So during VIVA, the examiner, right, will just randomly pick some organs, forceps, equipment, and just place it on a table or a surface like this, and then some they may say identify and place it like this. You are expected as a student to identify all this. So some examiners will tell you identify this equipment before you. Some will go ahead and say identify and tell me the functions of this equipment if they are equipment, right? And if they are drugs, they will tell you identify this and tell me the indication or something like that. So for these things that I have in front of me, for these forceps and then this model of human vertebral column, so the examiner, let's take for example, the examiner said that you should identify this equipment. So during VIVA, what you're going to do as a student nurse or as a student midwife, you would carefully start from the beginning. It's either from the left or right? Then you say that please do not forget. The number one tip is that if you have an equipment that is like this, if you have an equipment that has a label like this, always look at it at eye level and read what is written on it. So you can see this is a fingertip oximeter, or you can call it as the general name pulse oximeter, right? So you already have an answer already on it. This is a fingertip pulse oximeter, right? So then you drop it. Remember, the examiner said identify. So you have identified specimen A, for example, and then you say this is what? Mouth gag, straight scissors, this is kidney dish or a receiver, and this is a model for human vertebral column, right? Now, the examiner again may go ahead and say, can you tell me the function of each of these specimens? So now you go back again from the beginning. This fingertip pulse oximeter, it is being used to take pulse and check the oxygen saturation of the patient by placing it on the finger of the patient. Remember, this is fingertip oximeter. Then you say by placing it on the finger of the patient or at the thumb of the patient to read the oxygen saturation and the pulse of the patient. Yeah, remember, you have set the function now. The second specimen, right? Then you pick the mouth gag and say, as I mentioned earlier on, this is mouth gag. And mouth gag is being used to guard the patient's mouth, most especially unconscious patients, to guard the patient's feet or to make sure that the patient's mouth is open while performing oral care to an unconscious patient. That's the major function of mouth gag. The next specimen is what? Scissors. We use it to cut adhesive plaster, gauze, right? And sometimes during wound dressing, if there are dead tissues, you can pick it up with dissecting forceps and cut some dead tissues, right? The next person is receiver. Of course, as the name implies, receiver is being used to put solution, to put use swab during procedures, right? These are some of the function. Or to collect fluid from bodily fluid from the patients, right? These are some of the function. And this model of human vertebral column, it gives support to the human body. It's to give support for standing and movement, right? During standing, and it forms a frame of the human body. Now that we have said this, the examiner sometimes may continue to ask you some question, and she may or he may not continue, right? And if you watch, please, if you watch, you have answered all the questions that the examiner asked you, right? So always be attentive. Be attentive to the question when the examiner said, anytime I go to exams during VIVA, like this, I'll just say, identify the specimen before you. I'll identify the items before you. You identify. Do not say the function. Remember, the question said identify. Then after identification, then I may ask again, as I may say, tell me function, two function or a function of each of the items before you. So always pay attention to the question the examiner is telling or asking you, right? By doing so, you'll be able to answer your question correctly. Remember, VIVA carries 10 marks in NMCN professional examination. So you can't afford to miss that 10 marks, right? So, and I hope that this video is helpful, and I know that you will share it to your colleagues, to other students around the world. Thank you for watching. Nurse Clement B. Till I see you next time.